You're listening to Parent MD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. Welcome to Parent MD. Today we have a special guest with us, Dr. Audra Rankin. Welcome.
Hi, thank you for having me.
Well, it's a real pleasure and treat. Our paths have crossed multiple times through the years, and it's a treat having you as a guest today. And I want parents to understand and hear the richness of your background. On top of that, you're a mother of two, and you have a doctorate in pediatric nurse practitioner realm, and you've had just a lot of interesting experience in the clinical realm and in administration and education, as you have an MBA as well. So I'm looking forward to our conversation today.
Yeah, thanks for having me, and I'm excited to talk about just advanced practice nursing and the background and education route that I had and how many of my colleagues have had similar paths and how that can relate to the healthcare team.
Yeah, I think it's really important. We've had a lot of conversations so far with other pediatricians. We've had one psychologist at the table, and I'm sure excited to have a nurse practitioner with me in this conversation because I want parents to understand that the world of pediatrics and delivery of healthcare has changed a lot through the years, and it's much more team-oriented. There are more people that play roles. I definitely want to highlight and have parents be educated and aware of the training that you have and the role on the team and how much richer and better and higher quality it makes healthcare for our children. That's why I wanted to share this. And, I'll go back and give a little background for myself. When I finished training about 20 years ago, I had very little interaction with nurse practitioners. Had a few specialty nurse practitioners in the ICU, the NICU and the PICU for the little ones and for the big ones, but largely very limited exposure and even understanding the training and roles and such. But since I finished training 20 years ago, the world has exploded. And now many clinical teams are largely made up of nurse practitioners or physician's assistants, and it's a whole team approach, different than it used to be.
I'm happy to tell you a little bit about my background and how I became a pediatric nurse practitioner. And now, even from when I went to school, things have changed so much in the trajectory of education for advanced practice nurses. So you can have a traditional path where you receive a bachelor's of nursing in science, and those nurses typically are working in acute care settings or in community health settings as registered nurses. And then typically nursing students go back to school to either receive a master's or straight to a doctoral degree of nursing practice. And in that role, they function as advanced practice nurses, whether that be nurse practitioners or nurse midwives or clinical nurse specialists. And that level of training is completely different than what you would see with a registered nurse. So for advanced practice nurses, they're getting education on diagnosis and, more advanced assessment skills, and then really how to provide therapeutic interventions appropriately. So we're able to address a lot of common acute illnesses as well as manage a lot of chronic disease that is a more advanced skill set than what you would see with a bachelor's prepared nurse. So I think that, to your point, it's more of a relatively new role, but one that really works well in the healthcare team. And I think that what we're seeing right now, particularly in the pandemic, is that there's such a need for healthcare providers. And so it really fills this gap of access to care and addresses a lot of healthcare disparities that we're seeing in our country as well.
I think the background of nurse practitioners is so key and so great, because when you come to the table with an RN, a nursing background, then you come in as a clinician, different levels of provider. I'll be honest, I tend to see you all as more compassionate, more understanding of the team dynamics, supportive, where physicians, we come into our role honestly straight kind of at the top of the food chain, and many times we don't understand and I think appreciate the whole delivery and continuum of care like a nurse has. And then so coming into that background, you mentioned a couple of terms, and I want to make sure the audience understands the difference between the two. So we got nurse practitioner and advanced practice practitioner, advanced practice nurse. So are those the same? and how would they be different, and why would they be used interchangeably or different, and talk. So, because I think folks, it's just like we had a conversation recently between a psychologist and a psychiatrist.
Right.
It can get confusing. So talk to us about that.
Yeah, no, that's a great question. And, interestingly enough, my students often struggle with those terms and if they can use them interchangeably or if one is different than the other. And I think people in healthcare sometimes get confused about that. But because there are so many levels of entry into practice for nurses, there's been a huge push with something called the consensus model to streamline our education and certification and licensure so that it's the same state to state. I think one of the things that's a little bit tricky about advanced practice nursing is that each state regulates it a little bit of a different way. And so what I can do in the state of Kentucky is different than what I could do in the state of Florida, different than what I can do in the state of Washington. And so the consensus model has pushed for this term of the advanced practice nurse to really showcase that it's a level that's a little bit higher than a bachelor's degree of nursing. And there are 4 functions within the advanced practice nursing role, one of which being a nurse practitioner. So you can use those terms interchangeably. A nurse practitioner is an advanced practice nurse. Not all advanced practice nurses are nurse practitioners, if that makes sense.
Yeah, that actually helped. I think that added clarity in a way that I hadn't appreciated before. What about becoming having a doctorate as a nurse practitioner? So why get that? How does that differentiate you? What's the extra training to achieve such?
When advanced practice nursing and nurse practitioner programs opened, at that time, most nurse practitioners were receiving a master's degree. And that really focused on, it was a 2-year degree and focused on assessment, diagnosis, therapeutic interventions. The doctoral program came about because what we found was that advanced practice nurses were functioning in roles where they really needed additional leadership skills. They needed to think about how they were improving health outcomes at a completely different level, how they were well-versed in finance and policy. And so that doctorate of nursing practice degree focuses on how we really think thoughtfully about improving healthcare delivery and outcomes, how you can do quality improvement projects and evidence-based practice projects. And so that doctoral degree requires that you have some sort of scholarly project where you showcase your clinical expertise in something. So, for example, for my doctorate degree, I was very interested in childhood obesity prevention, and my scholarly work all focused around how we can partner with community stakeholders to improve childhood obesity prevention strategies in rural and underserved areas. Other, nurses may focus on things that are in acute care settings, which would mean hospital settings or ICUs. Advanced practice nurses can be functioning in pediatrics or adult worlds, so it kind of is individualized, but the main principle is that we're thinking on a higher level about how we deliver care.
Folks with the doctorate level training tend to do more leadership, administrative, teaching, research roles, correct?
Yes.
Okay. With that being said, I would have normally started out with getting clarity in your training and your career path. Let's come back to that for a second. Walk through so the audience can appreciate your background and such.
Sure. So I received a bachelor's degree of nursing from the University of North Carolina at Chapel Hill, and right after school worked in an acute care setting on the bone marrow transplant and hematology oncology floor at Duke University's Children's Hospital, and did that for a while and decided to go back to school to get a master's degree. So I went to Vanderbilt University and got a master's as a pediatric nurse practitioner in primary care. And so I shifted from, a hospital setting or acute care setting into really focusing on community-based care and working in primary care clinics. And then really my interest in receiving a doctoral degree happened because I was working as a pediatric nurse practitioner in a rural area and was seeing a lot of issues with childhood obesity and, poor management of chronic diseases. And I wanted to learn more about how to improve that. So I went back to school and got a doctor of nursing practice degree, really focused on childhood obesity prevention, and really got interested in how we formed these communities of stakeholders and different people to improve care. So I think thinking outside of our healthcare clinics and hospitals and more into how do we create environments where our kids are really, really healthy and happy was something that I became interested in, and that took on a world of its own in policy and business. And I found academia to be a really good platform for me for being able to merge all of those interests together. So I think that my trajectory is a little bit different maybe than some of the nurse practitioners that parents would see in a clinic, but not necessarily. I mean, certainly there are a lot of doctorally prepared nurse practitioners who are teaching classes or working in policy worlds or leadership worlds, but we have, kind of a trajectory where we focus on clinical education first and then kind of build upon that so that we really have a robust view of healthcare delivery.
So where did you get your doctorate at?
Duke University.
Excellent. And since then, our paths crossed several years ago, I think probably 12, 13 years ago at U of L, maybe 13, 14, I can't recall. You were back in Louisville and looking at that space. Since then, talk about your partnership with other entities.
So I started my academic career at the University of Louisville, which is a wonderful experience, and was able to teach and then also, practice in the Department of Pediatrics there. And then I moved to Johns Hopkins University in Baltimore, Maryland, and taught at the School of Nursing there and taught a lot of health policy and kind of the business of healthcare type classes, as well as some pediatric nurse practitioner courses. And when I was there, I ran the nurse educator certificate program. So that was for students who wanted to go back to school to learn how to teach, whether that be they were teaching parents in, clinics or teaching other healthcare providers or working in an academic setting. When I was doing that program, I realized that I just wanted to learn a little bit more about the business of healthcare and the business of education. And so they had a wonderful program at Hopkins where you could take business continuing ed courses through the business school for free. And so I would just took every single class I possibly could and got so interested in it, I decided to go back to school to get a master's of business administration. And that has been really wonderful because it helped inform me on, one, education, how we run schools, but also, when we are thinking about the operations of healthcare offices. So, when parents are sitting, and I'm a mom, so I understand this so well, when you're sitting with your kids in a lobby and waiting and you're thinking, oh my gosh, what in the world is taking so long? There's a whole method behind the madness of the backlog and staff. And so it was really wonderful to go through that program and experience, the complications and learn a little bit more about why maybe things don't flow the way that they should oftentimes in healthcare. So I did that while I was at Hopkins. And then when I finished up that MBA program, I switched my faculty role to the University of North Carolina at Chapel Hill, which is where I did my MBA as well. And it's been a wonderful experience to be back there, and I teach doctoral and master's nurse practitioner students.
So with all those experiences, what would you share with parents as the lessons that you've learned that you think it'd be great for parents to know that you've gleaned through the years as a parent yourself of two daughters, being in the clinical realm, the academic research, teaching realm, and looking at how medicine has transitioned in the last 20 years? Understanding healthcare delivery, you just mentioned that. I think that's why it's key for a number of folks to have extra training to appreciate the master's in business administration side of healthcare delivery and appreciating the operational efficiency and why things just don't run as well as they should, and we like them to. But that's why I think it's key for clinicians to have extra leadership and administration training so we can understand it, be a part of the problem. Not part of the problem, part of fixing the problem. Well, that didn't sound right. Part of the solution to fixing the problem, but then also in the education realm and things like we're doing today, sharing with others so others can learn how to take that to larger populations and truly improve delivery of care. That's been my passion since being in private practice. So I'm going to come back, and often I get going and take you away from the question I initially asked you. But what lessons do you have to share with parents and for them to understand about healthcare delivery that you've learned through the years?
One of the most important lessons I've learned is the value of a team. And when I was at Hopkins, we did this wonderful learning experience with our students where we would have medical students, pharmacy students, nursing students, students from a variety of different health disciplines come together, and they would watch a video about a patient and their family that had a chronic disease. They weren't told what the disease was, but as a team, they had to come together and figure out the best plan of care. And what was so wonderful about that was that each discipline, medicine, nursing, pharmacy, social work, whatever it may be, had a different problem that they wanted to address. So, the medical students went straight for the disease. The pharmacy students said, maybe these drugs are interacting, or maybe, this patient's mixing up their drugs. The nursing student said, well, who's taking care of this person at home? And are they falling? And can they get to the doctor's office and, the hospital? What came about in that experience was this really robust, well-rounded plan of care. Being thoughtful about, even though maybe team-based care takes a little bit longer or it feels cumbersome, at the end of the day, what you're getting is a really well-rounded plan of care that addresses holistic needs, and is something that adds so much value. And I think for a long time in healthcare delivery, we really only focused on addressing the problem and then giving a solution to that problem and sent people out the door and sent families out the door. And we didn't spend the time to think, okay, how do we help empower these families to be healthy and live their best lives by giving them all the resources that they need? And so I think that, when you appreciate the process of healthcare delivery, when it works well like that, then you come out as a family, with a really good plan of care that's going to be effective rather than something that may just be a short-term fix but not really move the needle.
Yeah. So with that, as you highlighted, healthcare is very complex. Mm-hmm. It even for us as clinicians, when we have families and friends going through the process of trying to get healthcare service, we often have to help them navigate. So to me, one of the big pieces of advice that can come from what you just said and packages the message to all those families out there, parents who are struggling, they have children who have diagnoses that are complex. If you don't have a team around you, you need a team. So if you're in an arena where you don't feel like people are coordinating care, doctors aren't talking to one another, or clinicians, whatever level and role they're playing, and you feel lost or you don't feel like there's good navigation, find a place that gets good team-based care. Mm-hmm. And that's without promoting any specific entity around
Absolutely.
the country. That's just understanding that some places do it better than others. But when you and your child need care, and it's complex care, it's got to be team-based. So I think it's a great point. And we definitely learned that through the years. And again, I feel like that's one of the values I've learned through the years of working with more and more nurse practitioners and physician assistants and such in my last corporate arena the last 10 years is that value of team. Healthcare is so much better. And you mentioned communication. How is communication enhanced and resource delivery when you have a team?
I don't know that it always is. I like to describe healthcare delivery in the terms of my 3-year-old. Well, really, she's kind of getting out of this phase, but for a long time, she did something called parallel play, which means that, and parents know this, when I describe this, they'll say, oh yeah, my kid does this too. But you'll have 2 kids or 3 kids together in a room, and they're all maybe playing at the play kitchen or playing with dolls, but they're not interacting with one another. So it looks like they're playing together, but they're really not. Sometimes that happens in healthcare delivery too. We're all in the same room, and we're all focusing on the same thing or the same patient, but maybe not communicating well with one another. And we're stuck in that parallel play mentality. And so I think that as a parent and as, a family member of people who have had chronic disease, one of the things that I really value is when I am with a healthcare provider and know that they know what other healthcare providers that have been taking care of me are thinking, and that they're all in the same plan of care. There's nothing more frustrating, I think, as a parent than to have one healthcare provider say one thing and then somebody else comes in with a different plan of care, and
Definitely.
that gets overwhelming and confusing. And it's overwhelming and confusing for me as a mom who has a healthcare background, let alone somebody who doesn't come into these environments with medical knowledge. And so I think that really advocating on behalf of your family to say, hey, how are we coming together as a team, or who is leading this team is very valuable. Because I think sometimes that gets lost in the mix.
Yeah, I love highlighting who's the leader of that team. Ultimately, the parent has to lead, but they need a medical champion, and you hope that's your primary care doctor. But in some instances, you need to be the specialty doctor because you're leading something that needs that higher level of care. When I think about tools that are necessary, one key tool is an electronic health record. If everybody can't be on the same page for information transfer and to communicate, and not a portal for the parent to be able to access their own records and give communications and such, healthcare is disjointed at best. My mind went to Atul Gawande, as I think he really impacted the world for the physician and teams in the last 20 years. And, 15 plus years ago or so, he wrote an article. It was highlighting the role of physicians today compared to the old days. And to me, the old days are 20 plus years ago now. Those mean something different to everybody, but different people. But he highlighted in an article about healthcare has to function like a cockpit crew, and we have to be a team. The physician may be the driver in the car, but it takes the whole crew to make that car go and support that doctor. Doctors cannot be cowboys anymore. They cannot be independent. When we go into an OR and someone does a surgery, it's a team. The physician may be the leader on the team, but it is a team. And anybody on that team has the right to hold their hand up and say, stop, there's something dangerous. There's not something good. We can do this better. I need to share information. Everybody's empowered and supported to do that. I love that. To me, that's been exciting, inspiring in healthcare. And with that being said, that's why it's also been, I think, so fun to see nurse practitioners be more integrated on the team and decision-making and right there with the doctors. And I'll say it every time. Many times the nurse practitioner does so much of this better than the doctors. And what I mean by that, I think the bedside manner, I think the communication, I think relating with the patients, often being detail-oriented, listening. Nurses do a better job listening than most doctors. Now, that's not for every doctor. Some doctors who just have excellent listening.
Fighting words for
I understand, but I'm going to be bold and put it out there because I think we need to be honest and note that we each have different skill sets. And there are different strengths and weaknesses that we all play to. And I say this as encouragement for all of us as doctors and those at the bedside still, and I know I'm not, but to be better listeners and to show that compassion. Now, that often takes time, and sometimes, let's talk about that too, the volume of patients that sometimes, though a nurse practitioner has versus a doctor, often supports and does allow that. So we should highlight that for many physician colleagues. Often their volume is so voluminous and arduous, they don't have that time, and they're trying to run care for hundreds, thousands of patients. And nurse practitioners and physician assistants often have a smaller panel or in a group that they do have more time allotted, and that time is so key. But I will say that's another key piece in this healthcare delivery, where we're talking about these different chasms and gaps in care. Make sure your team and your provider can spend time with you, because if they can't spend time listening to what needs you have, then you might need to find someone else to help. And, those are many of the reasons that people often switch providers is not team and coordinate care and not able to get time to listen.
Right.
So, I think for both of us, a lot of the similar lessons through the years. So let's have fun for a minute and talk about as parents. So you as a mother, me as a father, through all of your years and experience, what kind of advice would you give other parents around parenting? Are you still learning and struggling with your two daughters?
Yeah. Becoming a mom has made me a much better nurse practitioner and faculty member, and really enhanced my perspective of my professional life so much. And what's so interesting is that before I had my first daughter, I was working in primary care and was a lactation counselor and a pediatric mental health specialist. I had all the certifications, all the things.
And I didn't know any of those.
And I would, see these moms come in with their brand new babies and say, well, I was following all the evidence-based guidelines and given the appropriate care. And I'd say, well, you just need to, nurse on 10 minutes on each side and get rest when you can, send them on their way, and felt like I was providing this really good care. And I was, in terms of, what the books said. And then I had my first daughter, and I realized that it does not matter what you read. Sometimes kids are just going to do their own thing.
They're all different.
They are all different. And so I think that I've become a much more compassionate healthcare provider because I've been so humbled in my parenting, and my daughters have taught me that it really doesn't matter what you do. Sometimes
and you can do everything right with the best intent, put all the energy, and it doesn't mean it's going to go the way you want, because each of these little human beings we create, they're so different.
So different.
And what you learn from the first one, it can sometimes be applied to the second one, but not always, right?
Not. Yeah. So I think I mentioned this, but my scholarly interest has been around childhood obesity prevention. And so in that world, I've had the privilege to write a lot of articles and policy statements, and I wrote a children's book about healthy eating habits for kids. And I was in the clinic and, was printing out all these handouts for families that were getting left. And I thought, I'm going to make a book, a story that kids can read, and they're going to really get behind and start eating healthy foods. And so this was before my oldest daughter was just a couple of months old when this came out. Again, kind of one of those things where I thought, well, all it takes to get kids to eat healthy is just to ask them what they want to eat. If we say, do you want to eat carrots or green beans? They're going to pick one of the two. Now I have an 8-year-old and a 3-year-old, and I kid you not, every single night at dinner, it's, a battle of, well, why can't we have goldfish, crackers for dinner? Why do we have to eat these carrots?
It's in the closet. Yeah. Can't you just go get the box,
exactly.
Mom?
Yeah, it's right. I know it's right there. Those Oreos are right there. Even the best laid plans, I think sometimes just don't, happen. You do all the right things and you're not doing anything wrong, when your kids maybe don't follow what your healthcare provider is telling you to follow.
We could talk about this for hours, I think, in the approaches, lessons learned, the phases of childhood and decision-making and accountability, and when you have to be the authoritarian figure, but when you allow them to be a part of the decision-making. So what was the name of the children's healthcare book that you wrote?
Gordon Galloway's Mealtime Makeover, which is a mouthful.
I was going to say, it's a long name.
It's a long name. It's about a cow that was eating unhealthy foods and was getting bullied at school. And he and his class go to a farm and learn how to grow healthy fruits and vegetables. And, as all children's books do, it wraps up in a couple of pages about how the family has this huge change and they start eating healthy and going to bed on time. And at the back of the book, there are motivational interviewing questions where, the idea is that clinicians can use those questions to guide families to come up with their own healthy lifestyle decisions, so rather than my traditional approach when I was a brand new nurse practitioner was, you need to eat 5 servings of fruits and vegetables a day. But that's really not realistic, right? Because maybe your families don't have access to fresh fruits and vegetables and you need to uncover that. But maybe, they only want to eat one. And that's really better than anything.
It.
Yeah, embrace anything.
To me, that's one of my biggest things as parenting I learned through the years is embrace whatever you can get.
Yeah, exactly.
Don't die on the sword on certain topics. Do the best you can and realize everything will work out. Some of these topics we will come back to. And there's so much more. I want to highlight before we end, though, a new podcast series that you and a colleague started. Talk to us just a little bit about that, and then we'll close up.
The podcast that my colleague and I just started a couple of months ago is really not related to pediatric healthcare at all, which is so fun for me. So I, as I mentioned, teach in a doctoral level nursing program. And one of the things that we talk about are leadership principles and policy principles. And I was really struggling with finding resources that were user-friendly for our students and, brought in perspectives outside of nursing and outside of healthcare. And I think one of the things that we highlighted today is that, you have so much more of a well-rounded, robust approach to healthcare delivery when you have different perspectives and, everybody brings something different to the table. And so I have really been thinking lately about how other industries and disciplines can inform how we deliver healthcare. And so the premise of the podcast is that we interview people that have nothing to do with healthcare, no medical background whatsoever. They're musicians and athletes and business leaders, and we ask them what they do day to day. And what we found in every single interview is that they are doing something that we can learn from and apply to our practice or to healthcare delivery, in general. And I think that, just this value of learning with, from, and about others is so important. And it's really, on a much more broader scale, what you all are doing with ParentMD. You're learning from these experts that are coming from all different parts of the country and bringing everybody together to provide this well-packaged perspective on pediatric care. And so we're doing that just at a different level with different disciplines.
Now, that's exciting. That reminds me of a conversation I had years ago with Stephen Levitt, who is one of the two authors of Freakonomics and Super Freakonomics, which is one of the most exciting reads and fun reads, but just really makes you think differently about economics and decision-making and innovation. But I got to talk to him for just a few minutes at book signing, and he just talked about innovation. I asked him about, what helps one be innovative. And one of the three things he said is spend times with people outside of healthcare. Because he said, what are you? I said, I'm a pediatrician. He said, you need to spend time with people who aren't in pediatrics, aren't in healthcare. And that also reminds me of a recent book that I read called Range. You are a generalist if there ever was. That doesn't mean you're not specialized and specific in your training along the way, but you have this generalist mindset and background. And for the audience, if you want a good book to read about those who are involved in a lot of different things in a career and will pivot and go wherever their interests are and be willing to be bold, I think, Audra, you've done that in a big way. I'd like to think that reflects a good bit of my career and my background because I'm intellectually curious, and I like doing different things, and I like being a part of different ways of thinking and meeting different people. Hence, our eclectic backgrounds. But that book really speaks to it. So if anybody hasn't gotten to read that book called Range, it's just a great book speaking to that. And when you're a generalist, you tend to be more innovative, a better problem solver, because you have different perspectives. You've seen a lot of different things. And that's what's made this podcast, Conversation Day, so interesting to me. So thank you for being with us, and appreciate you being a guest with us.
Yeah, thank you for having me. This is so much fun. I'm
sure you'll come back at another time. So thanks for supporting ParentMD, and good luck with your podcast and all that you're doing.
Thank you.
You've been listening to ParentMD, the podcast where top pediatric experts do the homework for you, sharing clear and trustworthy medical advice so parents feel empowered to take the very best care of their kids. If you enjoyed today's episode, go ahead and click on that follow button on your favorite podcast app. It's the best way to make sure you never miss a single episode. And while you're at it, why not leave a 5-star rating and comment as well? We'd love to hear your feedback, and it helps other parents find the show. The ParentMD podcast is a part of ParentMD, a new way for pediatricians to help parents. ParentMD is an online source of parent information you can trust, straight from board-certified pediatricians. For more information about ParentMD, visit us at our website, www.parentmd.com. That's it for this episode, but we will be back soon to tackle another topic to help parents make confident and informed decisions about their children's health.